Let me introduce you to today's presenters. We have Luis Diaz from the Agency for Healthcare Administration and Cheryl Young with the Department of Elder Affairs. If you would please hold all of your questions until the end, there will be a live chat feature available for you to send any questions you may have. Our presenters will answer as many questions as they can until the webinar period is over. I will now hand you over to Cheryl.
Good afternoon. Our objectives this afternoon with this webinar are to define and explain Medicaid pending, to explain how Medicaid pending will affect statewide Medicaid managed long-term care applicants in nursing facilities versus community-based settings, and to clarify the differences between Medicaid pending under the nursing home diversion waiver and the new long-term care program. The Florida legislature provided in Section 409 of the statutes direction for the Agency for Healthcare Administration to develop a process for the enrollment of and payment for individuals pending determination of Medicaid eligibility. The legislature directed the agency to establish a work group. One of the areas that they discussed was Medicaid pending, and the work group made two recommendations regarding Medicaid financial eligibility. For nursing facility care, the recommendation is that the agency shall ensure nursing facilities receive payment for individuals whose Medicaid eligibility is determined retroactively prior to their enrollment with a managed care organization. And this includes the fact that the state will maintain a separate fee-for-service payment system for nursing facilities. And regarding home and community-based care, the recommendation was that the agency shall develop and incorporate a retroactive eligibility and payment process that allows individuals access to home and community-based care as quickly as possible, even if their financial eligibility for Medicaid has not yet been determined. So what is Medicaid pending? Medicaid pending is when recipients elect to enroll and receive home and community-based services before their application for financial eligibility is approved. The reasons for Medicaid pending include the fact that individuals that qualify for a long-term care plan may be elders or adults with disabilities that have chronic illnesses and require long-term care services right away. Another reason is that individuals are given the option to either receive services without verified Medicaid financial eligibility or wait for Medicaid financial eligibility to be verified to start receiving services. And now Luis is going to share.
Good afternoon. Medicaid pending process. After the Medicaid application has been completed, the DCF application information will be sent to HealthTrack, a system that is used to complete enrollment. HealthTrack will store the information until the applicant's level of care from CARES is received, stating the member is clinically eligible for the long-term care program. Therefore, HealthTrack will be receiving the Department of Children and Families application information stating the individual has applied for Medicaid and the level of care from CARES, indicating the individual is clinically eligible for long-term care services. In order to enroll with an SMMC long-term care managed care plan as Medicaid pending, applicants must have completed the following steps: filed a Medicaid application with DCF, received clinical eligibility. The Medicaid pending process. Once an SMMC long-term care applicant has completed these two steps, they have two options. They have the Now option where clients can choose to enroll with a managed care plan and a Medicaid pending status. This will allow the recipient to receive services immediately, but puts them at risk for the cost of services received if their application for Medicaid is later denied. Or the second option is later, clients can choose a managed care plan but have the enrollment broker hold the choice until their Medicaid application has been approved by DCF. They are not formally enrolled with a health plan and do not receive services until Medicaid is approved. There is also the application to wait when choosing to receive services later. Choosing to wait means you opt to wait until you receive approval of eligibility to both choose a plan and receive services. What does the choice now mean? If the individual chooses to get LTC services now, they will be enrolled in the plan of their choice for the next enrollment cycle. The plan choice will be sent to the managed care plan, and the member will receive a confirmation letter stating the plan choice. Effective date and another reminder about getting services now without approved Medicaid eligibility. During this Medicaid pending period, the managed care plan cannot deny or delay services based on the individual's pending Medicaid eligibility status. There is a financial risk to the Medicaid recipient associated with receiving services prior to receiving verification of Medicaid eligibility. What does the choice later mean? If the recipient decides to receive long-term care services later, their services will not start until Medicaid eligibility has been approved. Although the recipient chooses to get services later, they may still choose a managed care plan. The managed care plan choice will be saved in the system as a pending enrollment until Medicaid eligibility is approved. A confirmation letter with the managed care plan will be sent. However, since there is no eligibility yet, it would not indicate an effective date. We have two enrollment time frame examples. Example 1, if a recipient begins enrollment with the plan effective 9/1/13, but Medicaid eligibility is approved effective 10/1/13, then the recipient is responsible for paying the plan for services rendered for the month of September. Example 2, if a recipient begins enrollment with the plan effective 9/1, Medicaid eligibility is approved effective 8/1/13, then the plan will only be paid for services rendered September going forward. What does choice wait for eligibility to enroll mean? Recipients can also choose to get services later and wait to make their managed care selection when eligibility is verified. When eligibility is granted, these recipients will receive a letter that lets them know that they have 30 days to choose a plan and informs them of the health plan they will be automatically enrolled in if they do not make this choice within that time frame. They will have 90 days from the initial effective date indicated in this letter to try out either their chosen or automatically assigned plan and change it for any reason. Now back to Cheryl.
Thank you. So the managed care plan Medicaid pending protocols. Managed care plans are not allowed to delay or limit services provided to Medicaid pending members. If a member is denied Medicaid eligibility for some or all of the enrollment months spent in Medicaid's pending status, the managed care plan can seek reimbursement of the cost of services rendered from the member for the ineligible time period. If a member gains Medicaid eligibility, the managed care plan will be reimbursed for the months in which the enrollee receives services in a Medicaid pending status, pursuant to the rates established in the long-term care program contract. Medicaid pending recipient protocols include the fact that Medicaid pending recipients are not allowed to change plans while in a Medicaid pending status. Members can choose to opt out of Medicaid pending and stop receiving services until their Medicaid is approved, but they may not change plans. Once a member receives Medicaid eligibility, he or she will have a 90-day change period to switch managed care plans if desired. And again, after the change period is over, members are locked in for the rest of the year until their annual open enrollment period and can only change managed care plans with an approved just cause or good cause request. There are some differences in the statewide Medicaid managed long-term care program and the nursing home diversion waiver. Some of these include the fact that Medicaid pending under statewide Medicaid managed care differs from diversion's version. SMMC applicants must file a Medicaid application before they are enrolled with an SMMC managed care plan. Their referral for enrollment will not be forwarded unless they have filed the application with DCF. That is a very significant difference from the diversion program. Additionally, SMMC managed care plans will only receive Medicaid pending members, again, who have filed their DCF application. The process known under diversion as the 606 and 608 process will end. The statewide Medicaid managed care plans will not assist with initial DCF applications. This is a change. Instead, the managed care plans will continue to assist if they are providing services to someone in a Medicaid pending status and they need assistance with the remainder of the financial eligibility process, meaning their application has been filed, but they need assistance from their case manager with getting in additional paperwork or items requested from the Department of Children and Families. Medicaid pending members will show up as enrolled with their managed care plan in FEMIS while Medicaid pending. Let's talk about Medicaid pending in nursing facilities. Long-term care applicants who reside in nursing facilities will be subject to the same retroactive eligibility process under statewide Medicaid managed long-term care as they are currently under the Institutional Care Program, ICP Medicaid. This is technically different from the SMMC Medicaid pending process, which again only applies to recipients in community settings. Individuals in nursing homes will not have the option to enroll in a managed care plan until their eligibility for Medicaid has been approved by DCF. According to the Medicaid Nursing Facility Handbook, Medicaid eligibility can be granted retroactively by DCF for up to 3 months before the date of the Medicaid application if the applicant meets all eligibility criteria, including level of care. And remember, we're talking about for Medicaid nursing facility services on this slide. This slide, again, repeats the resources where you can ask questions about today's webinar and Medicaid pending or any other topics that you have a question about regarding statewide Medicaid managed long-term care. Your questions may be emailed to flmedicaidmanagedcare@ahca.myflorida.com. And please be sure and sign up for updates about the statewide Medicaid managed care program. The updates are posted at ahca.myflorida.com/statewide_MC. Upcoming events and news can be found on the News and Events tab. and you may sign up for the mailing list by clicking the red Sign Up for Program Updates box on the right-hand side of the page.